So the
Yes.
criteria that I use as a personal guidance for the guest selection on my podcast are based on principles of inclusivism, as long as a person possesses a relevant expertise and inclination towards biohacking.
Yep.
Speaking of the latter, I would rather resort myself to a broader interpretation of the term biohacking. As a person who sees body, mind, and spirit as an undividable unity, I believe in holistic, multimodal, and multi-directional approach towards the betterment. Yes, yes, the betterment. Being an open biological system, a human organism has phases of growth, development, propagation, and deterioration. And when left without maintenance and proper support, almost certainly ends up on a path of accelerated degeneration. At the same time, as a person who has adopted an experiential methodology in learning and perception of reality, I'm absolutely convinced that on the path to perfection, the journey itself is the reward. So my guest today, Dr. Thet Lwin, is a medical doctor who, similar to me, has embraced the all-inclusiveness, holistic style of practicing medicine. A rare case in modern days, I have to admit. Dr. Thet is not afraid of exploring new therapeutic possibilities, integrating different treatment strategies, and most importantly, he is constantly learning. Such a hunger for knowledge, a new experience, is a rarity in contemporary healthcare system. What could possibly be the roots of such character? Let's allow the presupposition that such traits of personality are inherent to the migrants. A Myanmar national, Dr. Thet studied in UK and USA and currently resides and works in Thailand. He is the faculty member of the Academy of Integrative Medicine, Anesthetics, and American Academy of Anti-Aging Medicine. So, brother, as I said, I really appreciate you accepting my invitation for this conversation. Yeah.
Yes, from my side also, I do appreciate and really thank you for inviting me there, and it's a great pleasure for me because we have the same gut, same idea, and we are on the same pathway to change the new platform of the healthcare industry. And we need to collaborate each other, we need to learn from each other, and then we need to develop, not only with the healthcare professionals, but our aim is to get along well with also with our clients and all the general publics to involve. So
Yeah.
yeah, that's our aim. Yep.
Yeah, yeah.
Yeah.
And
Thank you.
while doing this, I think both of us would agree that we should be open to a reasonable alternative methods of treatment and
Yep.
something from the holistic domain, use of all that physiotherapy, and
Yes.
all the devices, like the hyperbarics and all, and
Yes. Yes.
something that is not just by the book, of the
Yep.
general medicine. Yeah,
Exactly.
something that it goes
Exactly.
beyond that,
Yes.
beyond that.
Yes.
How many years are you in Bangkok?
Already 2.5, 2.5, around 2.5.
Look, I've gotta say that you are like a celebrity, So a lot of people, they know you, and so people really talk about you because you have great vibes, and then you get along with patients and you
Thank
explain
you.
things, and then what I hear from other people is that the way how you talk, the way how you explain medicine, or rather, what's happening to the person and what you're trying to do, is very understandable and very comprehensive for other people.
Thank you. Yep.
So 2 over years, and you are doing that great. Okay, what have been you doing before that, or are you doing anything same time, like in a parallel dimension? You still explore further studies, or you have projects in other countries, and also
Mm.
how? Yeah, and I know you're very young. Okay, so it's
Yes.
probably like a good. I'm not quite sure how many years, but
Yes. Okay. So in talking about that, I think it may be the reason is that okay, to go back to my journey to this to here, and previously of course I am from the conventional medicine side. I wanted to be the
Mhm.
cardiologist, but at that time, since I was young, since I passed the high school while I was in the medical school, what I was doing is not only about the medicine. At the same time, I was also doing teaching and
Mhm.
also the public speaking. And I write some of the articles for the public education and for the public awareness for the healthcare, everything. That
I
was
would need
my
those
journey.
links. I would need those links because I want to put
Yeah,
those links in a description to this video. I want to read it
yeah,
myself, and I want people out there to read it as well.
yeah. So that was my how to say, my habit, and I all the time write and talk to the other people. And then got when I got the chance to go to the PhD for the cardiology, but at that time I found like, okay, that is like very conventional way. And actually it was my dream to be in, to be in that position. But I think I should not limit myself to talk to the other people, because let's say, because my background is in cardiology. Whenever I talk to my clients, whenever I talk to my patients, I've tried to explain them all about these disease problem and how to take care of themselves and everything, especially for their lifestyle modification and for the preventive aspect also. Whenever I talked about that, to be honest, I found myself, I've got a lot of limitation, and I did not have enough things to explain to them, to talk to them. And then at that point, I tried to find what would be the best solution for me to get more knowledge and to get more powerful things to talk to my clients and to talk to my patients. So that's my main idea. And at that time, I was interested in the research, but okay, my behavior is like, instead of the research, I'm interested more in dealing with the patients and giving them more education and to talk about. I want
So
them to
you wanted
understand
to
more.
go to the clinical work
Yes, clinical
more than
work and
just
public education as an
in public
educator, more
education.
than
Yeah.
just the research. That's my main idea. That's why I'm all the time trying to make it clarify. So, for example, I think whenever I read my medical articles or any chapters or anything else, I all the time I do three steps. Number one step is that I try to understand by myself. And number two is that I want to try to understand to the level and to the way that I can express to my colleagues, especially like I want to teach. So what will be, how will I teach that article? That's number two. And number three is that all the time I'm trying to translate that one into the public way. So I think maybe because of that habit and the way that I'm doing is become more understandable. I think these are more approachable. Yeah, maybe that's one of
I'm doing the same. I'm doing the same.
yeah,
Whatever I read, if it's really a good stuff, and something that has a further implementation, I would always forward it to all my friends, colleagues. We have these small medical groups, in our department and stuff like that, share here and there.
yeah,
And then it's always, apart from applying that to patients, it's also a very nice thing when you bring it up. So I think, like for me, there's some kind of formula that I've worked out like a few years ago. So I don't talk more about the specific treatment or specific product, something like that. And I just show the actual evidence
yeah,
that it was published, and
yeah,
in peer reviewed or whatever, so there is
yeah,
a background for this. And after that, I tell a story. I tell a story of a successful application of this particular treatment on somebody whom I know. Okay, so
yes.
it's
That's
like
the
you have
real way.
this, the two levels of explanation. So you have
Yeah,
the evidence, you have the story to
yeah,
tell, and then when these things merge
yes.
together,
Yeah, of course. That's like finding the confidence for
mm-hmm,
myself first, and then
mm-hmm,
I got the confidence, and then I try to translate it into the
mm-hmm,
patient level. And one more point is that, yeah, in previous 2.5 years in this industry, one more encouraging point is that whenever I talk to the clients, I have seen even some of the clients who have got a lot of special knowledge. I mean, in the current situation, we cannot deny the fact that,
Dr.
yeah,
Wiki and Prof.
yeah,
Google,
yeah,
they do
exactly.
their job.
I have seen a lot of patients who are coming to me who is talking about the anti-HFR, who are talking about these biohacking, who are talking about the
Fantastic.
oxidative stress. But actually, it's like, number one is amazing. Number two is
Mhm.
challenging.
Yeah.
Challenging. So I understand myself like, okay, as a healthcare practitioner, we must go beyond the textbook.
Hmm.
Let's go beyond these
Hmm.
evidence, and we must translate it into the patient's communication way. Otherwise, that is the good point. But the bad point is that they know some point. They don't see the real figure. They don't see the overall figure.
Yeah.
They are pointing out just the trees. They don't know the full
True.
forest.
Right. Right.
So I understood that our idea and that is like our duty. I mean, you know, my attitude is like, that is our new duty. New duty of the healthcare professional is not just to give the best hair care to our patients. We also need to educate in a proper way, just to let them see what is the full picture. So that's why whenever one of my clients come to me talk about the MTHFR, okay, you need to see the full picture of methylation. You need to see the full picture of detoxification, not only about MTHFR. You need to know that, something like that. So it's encouraging and really challenging. So that's why, you know, we need to learn at the time, not learning by myself, and we also need to translate, just like translation and medicine.
Right.
Previously, we were talking about translation and medicine, from research to bedside.
This thing is even more complicated because if you just go to YouTube and you start watching some of the channels, and there would have been a channel that would talk about health and all, and you watch, say, a video about the diabetes or the video about insulin resistance and stuff like that. And then there will be another channel, and then, well, they all sort of, they maybe are talking about the same stuff in the same way, in the same direction. Okay? However, there are some differences. But when you go in the search beyond that, when you will type in a search the name of the same blog, and then you add debunked, all right? And then you can see that the same guys in those channels, you know, and it's really hilarious. And it's a fight between the medical doctors and the naturopathic doctors, you know, the ODs, the osteopaths and stuff like that. You know, and they would say, hey, this guy have made this mistake, and that guy have made that mistake. And they're like making fun out of each other. And in the end, I think nobody is in a win of this situation, okay? I mean, well, of course, if you want to watch it as a comedy, you know, then you just do that. And then secondly, I personally appreciate every of those videos. You know, because there is a rational stuff, there's something new in every video, there's a nice way of looking at the situation, nice way to approaching it and all. And we all make mistakes. We know there's no absolute truth. Things that we were thinking in the past, even some mechanism of actions, you know, that we, of the same medications, we look at it differently. You know, so we have to have this all-inclusive sort of approach to that, you know, and then as long as it's reasonable and has the enough evidence for that. So, and that's what I call the holistic wellness. And I believe that you also look at it this way. So for me, it's a bunch of practices or certain systems and methods that I do of not only with the nutrition or exercise, but with your sleep, you know, and planning your day and routine, you know, and of course the nutrition and medications that you take and all, because ultimately those are all biochemical compounds which in one way or another alter your physiology and all. So on your career pathway and growth as a expert and professional in your field, who you would say would be some key figures or some big time players, you know, some influencers that you have been reading, you know, so somebody's work in the past or somebody who has inspired you, you know, or maybe an organization or maybe a movement, you know, it's not necessarily to be like a doctor or some key opinion leader, you know, so what shaped your views until now?
You mean my views? You mean the specific person?
Yeah, well, specifically either the ideas, you know, or some views, or maybe it's an organization, you know, like some association which has that vision, you know, or specific training maybe that you have went for, you know.
So I think if we talk about that, I think it will be quite diverse. Number one point will be very diverse because as I said, when I try to expand my career from the conventional practice to more, you know, integrative practice, I found out
that's the thing. You still do conventional approach. So
still exactly. I'm still doing the conventional. So I'm doing more like, as you said, was a holistic way. When I try to change to the holistic way, I'm thinking, and I found out some of the, seniors and some of the top researchers and the clinicians in like maybe like some of the top cardiologists and some of the top physicians who are also doing these kind of advanced practices. So they are my number one, like how to say, inspiring people. So I found out some of the people, like for example, in the cardiology field, like Dr. Mark Houston, he's like he practiced more in the cardiology, and also he developed a lot for all these advanced molecular and all these things to integrate a lot more in our practice. So what he did is that very amazing. And also like all other people, they are like senior faculties in the
Which country was that?
Sorry?
Where was that?
From the US. Yeah, from
right.
the US.
Where
Yeah.
exactly?
So the people like that. And also some of the physicians, they are also practicing and seeing these metabolite testing, metabolomic testing, and all these genetic testing. They're also doing very well. So they are like my first senior. And then when I changed to that side, and of course, because of the nature for this regenerative medicine, I also need to develop more and more in the regenerative medicine field. So a lot of people and a lot of societies are trying in their own way. And some people, societies are collaborating each other, like, for example, like Age Reversal Network and the people, in these Age Reversal Fee and like Sense Foundation or something like that. They are, Sense Foundation. They are like the people, they are the really inspiring people in the aging field. And if we have to point out some people, like, of course, like in the genetic fields and how they are leading in the epigenetic
You're gonna
market.
say Sinclair, right? I know.
Exactly. David Sinclair, and whenever I listen to them and whenever I I follow them, I read their articles and everything. It's like they are like showing what is the real future. I mean, not specifically. I mean, not specific person.
Well,
as
if you wanna,
said,
if you wanna look, if you wanna know your future, you gotta look at your past. So he's the yeast genetic biologist. So
yes.
How come the person who has studied yeast, and then its propagation and whatever life cycle, cellular cycle, actually could explain the very fundamentals of aging and development of chronic disease and show how that can be reversed. And most interestingly, that I see his work, it's already, it's sort of like it's penetrating into the domain of physics, because it's so interconnected with the electromagnetic field and the earth magnetic field, and it's like, it's really, really something that we may not be having enough senses, to comprehend now the complexity of life.
Yeah. And also one more point is that, as doctor, as we said, all the fields becoming like in each and every field, they are trying to develop and they expand a lot more and more and more. But the good thing, what we all can see is that this field, they are trying to develop. But the good thing is that in the final stage, we now see like they are developing, but they are relating each other. That's a beauty.
Right.
That's a beauty. That's why what we can say is that we cannot say who is good, who is the best. Everybody is doing in their own field, but that's why I'm saying we need, number one, we need to be flexible. We need to be acceptable. We need to be very open-minded and see each other. We need to try to see each other in each other's fields. I mean, what is good in his lunchbox and what is good in my lunchbox, and let's try to make a bigger lunch. So that's the way that we all need to maintain and need to go forward. That's the thing. That's why if we say like, oh, who is the best, okay, he might be the best in particular matter. That society might be the best in that particular way. That's the thing.
That's why I like these conferences now, like the Rad Fest, because they bring together everyone.
Exactly.
And they're open.
Yeah, I'm gonna say about that.
And you have like, wow, such an amazing.
Yeah, that's what I said like that. We all the doctors, clinician scientists are talking about like translational medicine. What they are talking translational medicine is from the research to the bench side. But what these kind of people doing is like they are also doing the translating. Trying to translate, not from the research to the bench side. They are trying to translate from that bench side to the public field. It's so amazing that we are seeing like non-med and non-healthcare professionals are involving in those kind of research and those kind of summits it's like really encouraging for our future.
Absolutely.
Yeah.
You look at it from this way. Let's be honest, how many hours per entire 5 or 6 years of undergrad in medical school does a doctor spend for learning the nutrition? Well, I believe it's zero in
That's
almost
what
all
I'm going to
countries
talk
and
about.
med
Yeah.
universities in the world, So,
Yeah.
well, I'm a fantastic product of conventional medicine, I had the master's, the PhD, I worked in one country, I worked for another government, and yeah, well, we know there are there's many flaws in medical education. Okay,
Yes.
there's many blind spots there that are absolutely non-covered, and doctors, being by at large, been quite well, in a good way, like selfish people, so they would never admit its weaknesses to a certain extent, so they will just keep on talking about things they very often they have absolutely no idea of.
Yeah.
Okay,
Yeah.
and it's just a matter of learning, and broadening your understanding, and spectrum
Yes.
of your vision,
Yes.
So if extrapolate that to the disease,
Yeah.
you as a clinician, when you see a person in front of you, all right, I have my own method. Okay, I have my own guidelines, in how I assess the person, how I start the conversation, how I look for symptoms and stuff like that, how I read even blood investigations. Yeah, so you probably have your own terrain. Okay, so what would be your flow of thoughts? How do you approach to disease, to understanding what is disease, how you look for it, what are the parameters that you're looking at, the markers, and all that?
Okay, so based on our traditional training, what we trying to approach to get is like, what is the main diagnosis that the patient is having? In that sense, when you talk about the diagnosis, previously, since I was in the medical school and while I was teaching, seeing my patients, what we are trying to figure out is that what's wrong with them. Just we want to try to get one kind of diagnosis. But right now, I understand, I become more understand that even though I got that specific diagnosis, that is not the only one that is killing or that is giving the burden to them. So what I'm trying to figure out with my patients and with my clients is that not just finding out the diagnosis. I'm trying to find what are the current burdens on them, not only physically and also mentally, and also what is their main idea. Because as we said, it is the holistic way. So that's the number one point. So to make it happen, we need them to talk to us. We need them to talk to us. That's very important. So that's why my number
the
one
duly filled in questionnaire may not always be sufficient, no matter, and then the complaints over
and also
WhatsApp,
I would like to say one point. Who says these questionnaires are the perfect thing? Who said these questionnaires and these bullet points? I mean, 5 years ago or 10 years ago, we might say like this one is the best one for the disease A, but now it might become the toxin. I mean, these questionnaires, like, come on, it's like already like long ago. I mean, everything is changing. Why we are still stacking with these kind of fixed and specific things and approaching our clients?
Yeah,
and also
we're talking about the personalized medicine. First of all, it has to be person to person.
Yes. So to start the personalized medicine, we need to get the personal relationship with our clients. That is like warmness, and we need to see each other. Not just the eyes, not just the ears. We need to see each other with, okay, in a better way, like we need to see each other with our hearts. We need to feel them. We need to feel them and what is their burden. And only after that, sometimes, even though they don't think that is the problem, we could explore some of the things that they are thinking that is not the problem. But we could see some of the important points that is affecting their current health. And even for the medical point, for some of the clinical symptoms, they are not thinking that is the symptom. But when we become more familiar and become more approachable with each other, they will point out some of the things. But at that point, another important point is that, of course, we also need not to, lose our target. Sometimes, it will be like, endless conversation, and sometimes we don't get any clues or any points. So,
but
two important points.
As biological phenomena, what are you looking for? you're looking for inflammatory markers. You see this from a perspective of inflammation or some I don't know, the oxidation. You look for free radicals, you know, because
so usually what
I'm
we
even sending, you know, study a few months ago, even for the epigenetic test, you know, do it in Austria, you know, so even those things, you know, and the telomere.
So what I'm okay in my practice, what I'm doing is that as the normal, you know, long ago traditional, what we are doing is that we are checking the blood marker and some of the urinary markers. So that is starting from the clinical symptom. We try to I try to figure out to get more clinical symptom that is more reliable, and then from the diagnostic point, I use as a basic these blood markers and urinary markers, and apart from that one. I all the time try to figure out what wrongs with their biomolecular level. Sometimes I use the biomolecular testing and also metabolite testing. So I use some of the metabolites, especially for like people with coming with sleep and those kind of people. I try to figure out what is their like metabolomic levels and what like cortisol awakening and like dry urine test or something like that. And if I want to
That's
go
for
beyond
insomnia
further,
patients, right?
yeah, of course, insomnia, and also for like some of the people with chronic fatigue and those kind of things. And also if I have some of the clients who are, because in my practice, most of the patients are coming for like metabolic problems and cardiologic problems. So I all the time trying to find out with their metabolic markers, metabolic inflammation. And also sometimes I use, of course, genetics level, and I use some of the genetic markers to combine. Now I found out the epigenetic testing, and I haven't tried yet actually. I think we should collaborate. It's like basic
well, you should do
clinical
it for a
marker.
purpose. You should do it for a purpose. Okay, just you don't do it once. Okay, if you're doing it, do it as I did it after I worked extensively on myself for almost 2 years. Okay. And I was on the program that I have developed myself for myself, you know, and I was implementing that on the clients and all with some fantastic results, you know. So when I've done the epigenetic test after that, I was a bit disappointed, you know. I was 34 years old, my biological age. I was targeting less than that because according to the heart variability test, you know, and all those things like the biometric scanning and all that, you know, because they check your electrical activity and the heart variability actually, you know, so it's quite a good predictor, especially if you do it before and after an aerobic exercise, you know, just repeat it 5-15 minutes after that. So I was doing pretty well, you know. I was like 29, 30 years old. Okay, so the actual epigenetic, the global methylation test, I was 34. Now, but the good thing is that it doesn't mean that I'm doomed, you know. I always can push it a bit slightly worse, you know, just make it even less, you know, become younger. So when
so that's a very beautiful thing, you know, these advanced tests. That's why I'm saying, you know, every field is trying to develop to find out more markers, from the aging marker, from the molecular marker, from the genetic marker. So it's like I feel like so thrilled and lucky as a clinician. You know, I'm like, you know, reaping all these fruits and flowers that they have already prepared.
Right.
So I'm getting all these fruits from every field to apply in my clients, to apply in my patients. You know, it's like, I mean, okay, for these epigenetic and genetic marker, it's very futuristic, and we can use it and we can apply a lot. I mean, even for like, not for the low penetrance gene. I mean, even if we use for the high penetrance gene, in the meantime, my physicians friends and my colleagues in the oncology field, they are studying using those kind of things to adjust their cancer doses, like pharmacogenomic testing and all these metabolite markers. It's really amazing. It's really amazing. You know, that's why I don't need to be a researcher to find out these things,
because
but I'm
it's
just
already
using.
out there, you know?
That's why.
So, how would you then use that in a treatment strategy? What are the main directions that you are targeting when you're treating a person? And I would include everything here, even the external appearance. You know, if you apply the aesthetic procedures here and all, because skin is an organ, you know, the subcutaneous tissue is an organ. We have compartments of connective tissue, you know, we have loss of the extracellular matrix degradation, you know, so we have the sagging skin, you know, so literally, even if you're improving somebody's look, you are doing a great psychological and emotional support and to that person, and spiritually uplifting, you know, quite often, you know, gives you more confidence. And also, what are the directions that you apply in your treatment methodology?
Okay. in my treatment side, as I said, I've got all these informations from various aspects. And then what I can apply is that after I've got these information, I can see not only what is the problem in causing these clinical symptoms and these complications, we can see what is the real cause, what is the problem. Let's say I'll give you two examples. Number one example is like patient who is coming to me to see for his metabolic problem. Let's say even if the patient is having like high homocysteine level, we can say like just one of the inflammatory markers. Previously, we cannot get a very good clue for how we can find out what is the real cause of high homocysteine. But now is that if we check these metabolites, and if we check these problem in the methylation pattern, if we check these problems in the detoxification pattern, even though we cannot say that is the real one, but we can get more clues where what is the wrong point in their metabolism, and then I can approach more specifically. So that is the point. And also like I'm doing like aesthetic practice for like beauty purpose. So previously patient is coming to me, like let's say very, very clear, like patient coming to me with the acne problem. Previously we are just looking at the skin. We're just trying to figure out for the local problem. But now is that if we check their inflammatory markers, if we check their microbiome markers, if we check their problem in their skin cycling and all the collagen protections or everything, we can even check with the genetics, and we can even check with the other skin analyzer. And if we apply them very correctly, we can treat them what is their main cause. So
and then
it's like
it goes in cycles also, you know, the treatment very much is cyclic. Because you mentioned the homocysteine here and various markers. When you have quite a significantly destroyed metabolic system of the person, you know, and you start repairing that, you have some short-term and long-term goals, you know, and you cannot achieve everything in one go. You know, you get some benefits and you're going to compromise on something in the end, you know. And I'll give you one of my personal examples, okay? When I've reached my HbA1c about 4.5, 4.7 max, okay, I still could not bring down the insulin level tremendously low. I wanted it less than 5, okay, and it was like 3-4 times higher than that. And the actual reason for that, and then you know how I fixed it. Very interesting thing. Just fixed it in say 3 weeks, I would have said. Just by adding the sodium chloride, the normal salt, cooking salt. Well, because I was on a ketogenic diet, so I was on the calorie restriction, intermittent fasting. I was on the zero or low carb diet and all. And I was doing a heavy exercise, so I was sweating a lot, was losing with the perspiration and all, but mostly I was losing my sodium with the sweat, you know. So I was, although the blood reading was absolutely normal, but still you have that like intracellular hyponatremia, you know. And what is interesting in that insulin is one of the biological reactions. The insulin has the capacity to bind sodium. So it's a normal, very primal biological response to low sodium level, overproduction of insulin, and the insulin molecule is trying to retain sodium. So when I supplement yourself a bit of salt, you know, on my salad, you know, my insulin levels like went down 3-4 times.
Okay.
It's just, you know, that's what I mean. You know, these kind of things, when I have that terrain in my head, you know, the metabolic terrain, how it works, you know, it's like a chess game, you know, that's how I see this thing, you know, it's very, very fascinating.
Yeah.
So apart from that, sorry, you wanted to say?
Yeah, it's all right. Yeah.
Yeah. So your aesthetic practice, you start mentioning your aesthetic practice. I have not seen myself, but I heard a lot of stories. Okay, and I heard a lot of very good stories from you were using the threads, and you do not leave that completely. You use that as a scaffold, and you put the stem cells inside. So it's like absolutely minimum to zero invasive, clean job. You know. So how did all of that go?
Okay, so it applies the same principle. Let's say, for example, people have the sagging skin. They want to make it tighten. So of course, previously the only solution is like facelift surgery or whatever, and other energy devices. So what is the alternative? The alternative is like just putting like these kind of thread. But at the same time, the threat is like, okay, just to stimulate your collagen, and they will dissolve in a certain amount of time, and then that until that amount of time, it will stimulate more collagen, and after like 2 years, blah blah blah. It has so many mechanisms. But at the same time, on the other side, what people are doing is like they want to get younger and regenerated. I mean, even that's why I'm saying people are coming to me, they are showing their face to me. I cannot say that your skin is sagging, you need your skin more regenerated. I cannot say that your skin is loosening, you need more lifting, because they have their own desire. I mean, some of the people love their baby fat. Some of the people want to make it like a Kim Kardashian. I mean, you know, they have their own way. I mean, even though I'm saying your fat is not good, he might love it and she might love it. And also I'm saying like, oh, you need that chin is like that. He might say like, it's sexy for me or something like that. That's why I need to approach what he wants. So most of the people coming to me is that they want to get more rejuvenated. And at the same time, they want to get more like chisel look or defined look in their face. So on the other side, if we want to get rejuvenated,
not only rejuvenation, but also some of the people would have slightly different look because they think that
exactly.
So
So that's why we need to combine.
And you have the cases when do you have how often are the cases when you would personally disagree with your patient?
a lot, doctor. A lot. Sometimes I'm thinking like, that is your weak point. He said, no, that is my good point.
All right.
Sometimes like that. Yeah. But we do not need to, you know, talk a lot for, especially for the rejuvenation. So people knows that because of the aging, people know that is aging. So in my practice, for the aesthetic, around 75% coming to me is to get younger skin, to get more rejuvenated. So for those kind of people, if we go back to the stem cell, we apply just the stem cell. We know just the, you know, stem cell mechanisms. And if we put, if it is not in a good layer, whatever it is, you know, it depends on the layer we put, and also it depends on the stem cell life. So if we want to maintain more, I'll give you an example. Whenever I need to inject the stem cell to my patients, I always suggest them not to inject the stem cells first. You need to prepare your skin. Just like before making a plant, you need to prepare your soil. You get good fertilizer, everything, and then make a scaffold. It is like the building a house for your stem cell to dwell there for the long time.
Plus, if the patient has got some inflammatory changes in the skin, you know, definitely, especially the younger ladies, you know, there's so many cases when they come with this, and then
so that's why I've seen some of the
So it takes
some
time, you know.
Talking to me like and sometimes people come to me. I want facelift. I want to do the thread lift. I want to do the stem cell, but my first treatment might be probiotics.
That's totally makes sense. Or autohemotherapy, you know, or IV ozone. Yes, absolutely, totally makes sense. Right. When you understand the mechanism, how that develops.
That's the point.
On a deeper level, you know, not just on the level how it is described in 1 or 2 paragraphs.
That's why I'm saying it's very challenging. Sometimes I can challenge to my patients. Just wait like that duration. That just wait. You know, you cannot get the fresh water immediately. You need to wait some time. So that's why that we need to explain. That's why I'm saying we need to educate our patients why we are doing this, why this is important. Yeah, that's the thing.
Doc, not only the patients, but I think we have to expand the community of doctors and practitioners who also understand this. So for that reason, now look at it this way. We're supposed to have quite a big workshop in late May in Bangkok, which was postponed, you know, so probably we're going to do it sometime in, you know, after this whole COVID story is going to be over, you know, so probably in early September. That would be a great opportunity. If you don't mind, I officially invite you for this, you know, I want you to come on board, and we'll make it a part, you know, so that because these things that you are doing, and people talk about it like so easily, you know, like, oh yeah, Dr. Thet is doing that, because you are giving it in such a simple way, you know, like, but just for your information, you know, if you were in the United States or in the Western Europe, you know, you would have paid a big dollar to go and learn these procedures, okay, because these are done during the masterclass workshops, you know, these are not many people who are doing that, you know, and this is the stuff that people go and talk on the A4M, you know, on the other big conferences and all, and here we have a guy who has learned all of that, you know, both sides of both oceans, by the way. All right. So
Yeah.
yeah, in literally in 3 continents. Okay, and I'm very happy and proud, you know, working with you. You know, it's a great
Me
honor.
too. Yeah.
You know, and
Me
I
too.
think that we have a very good platform to develop that.
Yeah.
You know, so it's something that we should work and talk about after this meeting. You know, I'll talk to all
Yes.
the necessary
Exactly.
people. Let's
Yes,
make
we
it
can.
happen.
Yeah.
You know, because we can do the genital
Sure.
organ rejuvenation. You know, we can do
Yes.
the face sleeve, the hair treatment. You
Yeah.
know, and it's gonna be wow. You know, it's gonna be a major attraction to the whole
Yes.
establishment. You know, that we are
Yes.
engaged with.
Of
You
course,
know,
you know, as I'm talking to my clients all the time, after you have got a good genital sexual rejuvenation, it is one
right?
of the reasons that makes you look younger, of
Absolutely,
course, right? And also
absolutely.
after you have got a good and better look, that is one of the attraction for your sexual
Right,
rejuvenation.
right,
So that means
right.
that interrelated. Yeah, we
And
need to
not only
combine.
look younger, but you also feel younger. So you have
Yes,
a tremendous
yes,
spiritual uplifting and
yes.
psychological treatment, you know, so
Yeah,
you just improve all the aspects of
yeah,
your well-being, you know, and
yeah,
you know, there's some people still say these things like natural or unnatural and stuff like that, you know. So for me, there's no more natural or unnatural. You know, you eat the carrot or you eat the whatever, the avocado, you know, so you're consuming chemical compounds, you know, in a way that's gonna take place, participate in your biochemical reactions. You know, you just gotta look at it that way. You know, so how is that different from a good supplement or medicine or whatever? It's just a matter of registration, you know, but it
yeah.
helps your metabolism. And also when it's coming to aesthetic practice, what are your limits? Where would you go to, you know, and where you would say, well, probably I would not do this. So I mean that your take on the fillers, you know, and other like the Botox treatment, do you follow only one line, or you are like choosing what is the best for the patient or best for the case, and you can just do all of it?
Okay. In the aesthetic practice, actually, is also very quite diverse. So I have a lot of limitations because of I'm practicing also the other anti-aging and also regenerative medicine side. I'm not much interested in like I don't do any, even if it is like mini invasive, I don't do. For example, like lip surgery or anything. Even if we can do in like office, I don't do it. So I avoid and I don't do anything that I need to take the knife. So I don't do anything about the
Right.
surgery, including the mini surgery.
Mhm.
And also, I'm quite limited using a lot of like energy devices. I do like thermage, radio frequency, and some other things just for the face tightening, but I don't do invasive, a lot of lasers. To be honest, I don't have much time to practice them also.
Right.
Also, in my own clinic in Myanmar, I don't do these practice, and other doctors are doing it. And I do just mostly for the injection, for the regeneration and rejuvenation and facelifting and those kind of things. And also I do like adipose derived stem cell and millifat and nanofat transfer only for the face. And
All
also I
right.
do for the face and neck and hands, those kind of
So
things.
where is the harvesting? From which area usually the cells are harvested?
I
For the
usually around
mini
like
fat transplant?
sub-umbilical. Yeah, umbilical.
Yeah, yeah. And it's,
Peri-umbilical area.
yeah,
Yeah.
it's absolutely not painful procedure, you know, it's
No,
very
no, I can do in the
easy
office very
tolerated.
easily.
Yeah,
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 very
yeah.
easy.
No
Very easy.
possible
It's like
complications
just we
whatsoever.
don't even call it. Of course, if we want to do like big fat transfer in another area, we need a lot of fat to we need to like liposuction. For my procedures, we don't even call like liposuction. We call just lipoaspirate. We need just only a very small amount of fat, and then we
Right.
just process it. And so final SPF, whether it is cellular SPF or tissue SPF, the final one is only less than around 5 cc. So it's very quick procedure, and the result is really amazing. So I combine them together with the thread lid. I combine them together with the other systemic treatment.
Yeah, yeah. SVF means stromal vascular fraction.
Vascular fraction,
Yeah,
yes.
yeah. Stromal vascular fraction. So that's the thing that actually the queen essence, the concentrate, the specific that contains specific chemical compounds, the growth
We call
factors,
fat
cocktail,
cocktail. Yeah.
right? That
Fat
you
cocktail.
extract from that preparation, and yeah, it's almost done, almost not to say like totally immediate, but it's almost immediate. Yeah, very fast you can use that.
Yeah, very quick. Yeah.
Yeah. How about any other paramedical or alternative practices or whatever? Would you ever use that or consider using that in your practice? And any ethnical or national practices like all the traditional Chinese medicine, the Ayurvedic, you know, anything from the Myanmar, or do you use any of those?
No.
No.
No, I'm not doing anything like traditional Chinese or anything. No, I'm just integrating with the other bioregulatory medicine. So it's like
Right.
all these detoxification and all these like rejuvenation purpose for detoxification and repair. So I focus mostly on them. And of course, they all have their own role, but at one point, I don't have much time to explore more. But at the moment, to be honest, I'm quite interested in the Chinese acupuncture. Because at least for my people with the face lifting, I want to do some more things for that one. But I still cannot find any more time for that one.
Do you want to do that for the anesthesia purposes? Or
No,
why
no,
the
not for the pain management. Not for the pain
the
management.
pain management.
No, not for the pain management. I want to use it for the skin rejuvenation.
All right.
I want
Is
to
there
apply.
evidence
Yeah.
that it works like that?
Yes,
Is
a
there
lot,
an
a
evidence?
lot.
Really?
Yeah, a lot, doc,
Yeah.
a lot. Yeah.
Because I'm
It's like
you know,
based in the
acupuncture is one
previously,
thing that
I'm
I
also thinking
really
like, is
just
it
don't want to commit.
possible? What is that? Yeah, something like that. But I have studied some other things, and also I have already talked to some of my aesthetic colleagues who are doing those kind of things.
But have you
So
tried
what I
yourself?
want to do, yeah,
Have you tried yourself?
yes, I have.
And what? Well, somebody tried on me. You know, it never worked. You know, not even.
Okay, it
Not even
depends. I think it may depends on the
0.1%.
so many reasons. And one more point is that I want to integrate that one as one component. In my view, and as far as I've studied until now for those kind of things, you know, especially in the aesthetic medicine, you know, the integration and combination treatment is the best. So I just want to use them just for some of the integrative part. That's all. So, okay, let's go back to your questions. I am interested in it, but I still cannot find the time to do more of that and to study for that one. Otherwise, I don't do any other traditional medicine. Even for the integrative medicine, even though, let's say in the US, they call like functional medicine approach. I'm using some of the testing that is used by the functional medicine doctor, including the naturopathic doctors. But I am not saying myself as the functional medicine doctor because I cannot study like them. I don't have, I have much limitation in my knowledge and in my application. I'm using these metabolomic testing and functional medicine genetic testing, but I'm not practicing them like full-blown functional medicine practice. So,
I see.
I use them, and especially for the detox and for the integrative medicine approach. I use like colon, hyperbaric, ozone therapy, and hyperbaric oxygen chamber in my practice, and those kind of things. So yeah.
Hyperoxygen chamber, right?
Hyperbaric oxygen chamber. Yeah.
Oh yeah, hyperbaric.
Yeah.
You have
hyperbaric
also.
oxygen chamber. Yeah, what we have. Yeah, we have. Yeah.
Yeah.
So those kind of things. Yeah.
How about your country?
In my country.
Yeah.
In the meantime, no.
Yeah.
They are not practicing those kind of integrative. No.
All right.
They are not practicing. They are not practicing. Actually, in our country, it's still a lot of limitation. A lot. And so I'm now trying, and me and our centers is trying to start something in our country for these kind of integrative medicine things. And we have talked with some people in our country already. So we are on the right track. But I think all the COVID-19 situation stopped all our projects. And our
you need to build up a community there. You know, you need to build up a community.
I'm studying. I'm now studying it.
And with the pharmacies, with the compounding pharmacies as well. There has to be some kind of a lab, you know, for cell manufacturing.
So actually, in the meantime, what I'm doing is like I'm actually in my country. We can say like I am one of the first doctors who are practicing these integrative and regenerative medicine approach and these stem cell practice and everything. So it's like I've already talked to my seniors and some of the professors and also some regulatory bodies, important people from the government side. And I think it will happen soon. Yeah, I'm trying to do it. Yeah.
What are the other projects? Where do you see yourself? Okay, say it's not looking at 2 years, like 5 years and 20 years.
Okay. Okay. I think I will not have a lot more extension of the project. I will just base on what I'm doing right now. But even with what I'm doing right now, I have a lot of things to do because I want to develop more in the patient's clinical care And also I want to develop more in the wellness education. So it's like I want to make more institution or something like that, not only for the healthcare professionals. So it would be like that.
Yeah, I have that similar vision. You know, that's why I've started this so-called Global Biohack Alliance. You know, and I want to just bring just to create a network of people who know what they're talking about. And it's not necessarily should be only medical practitioners. You know, this can be people who practice dentistry, pharmacists, biologists, immunologists, researchers. You know, everybody, and enthusiasts. You know, for the matter of fact.
Exactly. That's what I'm going to say. It's very important part. Yeah.
Yeah, absolutely, absolutely. Look, what was the thing that you said before I start recording this? That it's what to accept that not being a loser, something about the loser and the winner. Remember you said about the loser and the winner. Yeah, can you repeat that again?
Oh yeah, of course. I mean, all the time saying like whatever you have a challenge. That's like actually it is like encouraging point to myself while I was in the UK. Whatever is that, I'm encouraging myself like, okay, come on, Thet. That is the game. That is the game. That is the survival of the fittest game. You need to survive. I mean, in the game of survival of the fittest, I'm saying all the time myself, like whenever I face any challenge or any problem, you cannot be the winner. But even if you cannot be the winner, you don't need to be a loser, right? So that's the point.
Right.
Very beautifully in the current situation, you know, in the current situation. I mean, all the business are, you know, if we can still sustain whatever form of business, I mean, not just in the healthcare industry, with the bare minimum cost, everything, you know, we can still be someone in that game. You can still play around, you know, even though you are not the winner. Right now, no one can say who is the winner or not. You know, even in the top people and top countries, they are still trying to survive. Yeah, that's the point.
And the ultimate goal, actually, of life is the actual experience now, and the ultimate reality is what we're experiencing now. You know, so anything that comes in life, I think we should just take it with grace and gratefulness, you know, and just go through that. And remember, all that does not kill me, only makes me stronger. You know, it's the principle of Hormesis. You know, we're gonna be tough times, good times, bad times. Come on, Led Zeppelin was singing about that like 30 years ago.
Very good point. Is that okay? Very good example. I mean, if there is no corona problem, you know, Dr. Dmytro will be very busy with his own patients and traveling around the world. I will be busy also, and we will not even have an idea to do these kind of things. That's a very good example. You know, I mean, and people are saying like, it's like there are so many
birth of something. Yeah, it's another level. You know, of course we're gonna get back to our normal life finally, and I believe it's gonna be very soon. You know, but important is that we are going back to normal life with better strength, better potential. A more focused vision of what's going to happen, where to head on, with a better knowledge. And then we keep on working also, you know, we keep on developing connections. We're trying to develop education and all. It's really great, really great what's happening now. And we're going to bounce back, I'm very sure. Yeah, we're going to bounce back. Yeah, there's no other way. There's no other way.
And I mean, I'm even seeing like, okay, from the, you know, if we think of success for any kind of business, people might see like income, cash flow, and profit. But I mean, in this time, because of, you know, you see, if you got, even in your crisis time, money and gold and all these oil and gas are not as much value as the food. I mean, the value is set by the people. That's why the profit is also set by the people. This time, it's like, even though we are not getting money or any kind of cash flow for our business as a profit, we are getting the profit on the other side a lot. Yeah.
Right. And we're getting more ready and more prepared and more empowered.
Exactly.
You know?
Yeah.
And
the important thing is that we need to be ready when the game restart.
Absolutely. No, this is like a drill. You know, everyone is put in this emergency situation, and it's like it's drowning. You know, and the ship is drowning. You know, the Titanic stuff. You know, imagine, and the water is cold, but still you find a way to survive and reach out for other people and us holding together. You know, just too big to fail. right? Yeah,
Yes.
because
Yeah.
we represent the actual power and all, and
Yes.
we can
And
really
in this
bounce back.
crisis
Yeah,
time, we can feel and we can see who is who, and we can see the real, internal and external features and everything of people around us. And we can see, well, it is not from the bad point, from the good point. When we see and when we clearly see who is who, we understand and we know how to, as I said, how to
correct,
collaborate more. That's the most
correct,
important thing, because
correct, correct.
everybody has their own problem. I mean, no one is perfect. I mean,
Right, right,
everybody is
right.
not perfect. But the important thing, as just like we try to communicate with our clients and our patients,
Right.
just like also in the interpersonal relationship. That's like we are seeing each other more and more, not only the good side, also the dark side. And then that's a good point to understand more and more and to fulfill the weak points of each other. Yeah.
Yeah, it's a great bliss to have that ability to judge or look at the situation that you are involved with from the point of view of your opponent. And I've achieved that few times, and it's really, with the deep practices, and stuff
Yeah.
like that. That point of enlightenment, and it really makes life much simpler, much more straightforward. It
Yeah.
sets and a lot of also in a large, lot of ways, it sets your moral values right. So I believe that even morally, those people who have a better principles, and something like that, they're gonna go through this and then survive
Yes.
this better, because after all, that's what's in your baggage. It's karma and dharma, right?
Yeah.
Yeah. Well, Dr. Thet, I thank you so much, brother, for this opportunity,
Thank you. Yes. Yes.
given to me. And I know this is Sunday. I hate to take your time, but I really enjoyed the conversation and all.
Me
So,
too.
if you don't mind, can we agree that sometime in future, we can come back again and have
Sure,
another
I will.
discussion,
Yes,
right?
yes, exactly. And also that is the very good starting point for everybody. And then we can develop more and more. And then we can share
Correct.
the idea and we can build up the better community, medical
Correct.
community, and also for our clients. Yeah, it
Yeah.
is very good for our platform. Yeah, as
And
you
we are,
said.
we are
Yeah,
absolutely open for criticism, for comments, as long as you are
yes,
engaging in a conversation, in a
exactly. Yeah,
productive discussion. So please come,
yes,
and
sure. Yeah,
every practitioner.
yes. Thank you. Thank you, doctor.
Thank you
Yeah.
very much, brother. All the
Thank you,
best. Keep the
doctor. Yes, all the
five.
best. Yeah.
Yeah. Thanks,
Thank you.
bro.
Have a
Dr.
nice
Thet
Sunday.
Lwin.
Have a nice
Yep.
Sunday.
You too.
Thank
All
you.
right.
Thank you, doc. Thanks.
Bye, brother.